Hello everyone, how are you all doing? I hope all of you are doing great. This is Dr. Vamshi Krishna. I practice cosmetic surgery, and in this video I am going to bring to you the differences between botulinum toxin and dermal filler. For lay people, these are the two confusing terms. I thought I'll make a video on it. Here on, I'll be referring to botulinum toxin as BTXA and to the dermal filler as filler. Let's jump in. The difference number one, let's look at the nature of the material. Botulinum toxin is a toxin, but it is used in minute doses. The actual toxin is one of the most potent toxins on the face of the earth. It is a neurotoxin, and it was allegedly produced in large quantities during World War II. For reasons unknown, but for cosmetic purposes, it is highly diluted to homeopathic doses, if you may want to call it, to make it very safe option and also an effective option for aesthetic uses. The hyaluronic acid, on the other hand, is a gel-like material, and it definitely is not a toxin. Let's go to the difference number two. Difference number two, let's look at the origin. BTXA originates from Clostridium botulinum, which is a gram-positive, rod-shaped, anaerobic and spore-forming bacterium. The toxin itself is present in the spores of this bacterium. It extracted from the spores of the bacterium. Hyaluronic acid, on the other hand, is produced in large quantities in human body. It has to be refined for usage. So the actual HA which we use is a non-animal derived substance which is produced after fermentation of Streptococcus equi. Going to the mode of action, BTXA acts at the neuromuscular junction, wherein its job is to cleave snare proteins, to which the vesicles containing ACH bind. Once the snare protein is cleaved, the vesicles cannot bind and ACH cannot be released into the neuromuscular junction area. So this will cause something called as flaccid paralysis, as there will be no muscle contraction due to flaccid paralysis. The clinical effect will be the weakening of the muscle, the effector muscle. The hyaluronic acid is produced in large quantities in the skin. It is one of the glycosaminoglycans which you must have heard in your medical education. And it acts differently at different areas, maybe commonly at different areas, but its role is different. In the supraperiosteal region, it adds volume. In the other regions, it may, it enhances the tissues around it. Here you can see hyaluronic acid being injected, and there is instant relief from those wrinkles. Difference number four. What do they do? BTXA basically weakens the muscle. The choice is of the surgeon or the injector whether they want to weaken the muscle or they want to completely, give a porcelain look. A moderate dose of BTXA will give you that subtle change in the muscle activity, wherein there is animation at will, but there is no animation whenever you don't want to animate. It depends on the doses of BTXA, and your surgeon knows better. Hyaluronic acid retains water. It gives that, glowing look. When something retains water, it glows. It looks fuller. It also increases collagen production and affects fibroblast morphology, all taking place at the tissue level. It adds volume, that's the most important thing, and takes the tissues back to their old glory. Difference number five. Looking at the types, BTXA is from, type from A to G. But botulinum toxin for human significance is A, B, and EF. The toxin which is used for aesthetic purposes is BTXA, toxin A only. Regarding the filler materials, there are various filler materials like silicone, hydroxyapatite fillers, polylactic acid fillers known as Sculptra, polymethyl methacrylate fillers, and the most common one is hyaluronic acid, about which we are talking in this video. Hyaluronic acid is also classified based on its G prime, that's thickness, if you want to call it, containing a lot of other factors, modulus of elasticity and all. But there are three basic types: thick, moderate and thin. High G prime is a very thick gel. It is used on the chin and also on the malar areas. It gives that lifting effect in those areas. A very low G prime is a very thin material. It is used for those finishing touches. It is injected always mostly in the superficial layers. A medium G prime material is used in certain areas of the lips and certain areas of under eyes to remove those dark circles of yours. Difference number 6, the packaging. If you look at the botulinum toxin, it is packaged in the form of a vial. But when you look at it closely, you will feel that you've been betrayed. It looks empty. There's nothing to it. But if you inspect properly, there is a thin film which is seen at the bottom of the vial. That is a toxin. You just need to add some normal saline and reconstitute it with saline and use it. The hyaluronic acid is packaged in the physical form of a gel. It is supplied in syringes. Usually it is supplied in the form of 2 syringes, each syringe being 1 ml. So in a pack you get 2 syringes, that is you get 2 ml. Regarding the dilution of hyaluronic acid, it differs from practitioner to practitioner. Few practitioners dilute it before usage and few don't. Now the difference number 7. What is the target area? The target area for botulinum toxin are dermal insertions. They are muscle insertions and muscles of animation. Here you can see the injection being very superficial. It's not very deep. It means we are targeting the dermal insertions of the muscles. And the filler acts at various levels, as we spoke already, mainly by rejuvenating the tissues and also by adding volume by being hydrophilic. Difference number 8. What is the end result? Here you can see 2 similar pictures, and when you inject Botox into a person with wrinkles, it irons out those wrinkles. So the cosmetic application is to remove those wrinkles. After injection, it takes 3 days time to kick in. The filler is basically used to give that youthful, plumpy and rejuvenated look, especially on the face. On lips it gives that plumpiness. Difference number 9. If something goes wrong, what can you do? Here is an example of one of the complications of BTXA, that is ptosis of eyelid. You can see the reduction of the palpebral fissure which happens because of wrong injection. There is excess upper eyelid show. That will be a big concern for the patient. And this happens because of hitting wrong areas with the BTXA. Now, can it be corrected? It can be improved, not totally corrected. It can be improved using adrenergic receptor agonist, alpha-2 adrenergic receptor agonist, but that is just a face-saving option. The key is to inject in the right areas and inject in the right plane. What happens if the filler goes wrong? Here you can see a lip being blown up, and if filler is overfill, if there is overfilling in wrong areas, in areas where you don't need it, you can always slice it using hyaluronidase. Difference number 10. Lethal complications. There are no lethal complications with BTXA per se, but with dermal filler there are potential vascular complications we have to keep in mind. Let us summarize what we have seen till now. The differences between BTXA and filler. BTXA is a toxin. Filler is a filler. BTXA is derived from Clostridium botulinum and dermal filler is derived from Streptococcus equi, the hyaluronic acid filler. BTXA acts at NMJ, the filler acts at tissue level. BTXA is derived from botulinum toxin A. Filler is made up of hyaluronic acid. BTXA weakens the muscle, hyaluronic acid enhances the tissue. BTXA is packaged in vials. The hyaluronic acid is packaged in syringes. BTXA target area is dermal insertion and hyaluronic acid targets tissues. BTXA irons out wrinkles. The hyaluronic acid fills and rejuvenates. There is no remedy if there is complication with BTXA, but the hyaluronic acid can be lysed with hyaluronidase. BTXA is not lethal. Hyaluronic acid could be lethal. Now, if someone raises a brow at you from now on, you just hit them with BTXA and the brow instantly falls down. I mean, it takes 3 days time for it to fall down. If you liked our video, please do like, share, subscribe, comment and press the bell icon so that you get notified whenever we make wonderful videos for you. Thank you until next time. Looking forward to meeting you guys again. Take care. Bye bye.